when you think about societal impacts of healthcare disparities, I think one instructive area we can look at today is COVID-19 and how the world responded to that pandemic, but also how that virus disproportionately impacted certain ethnic groups, as well as those who lacked access to quality health care. So not only from an ethnic background standpoint, but also socioeconomic, whether you're talking about rural America, you're talking about inner cities, and all of the country, our community. And so what I was really encouraged by during the pandemic is our ability to come together as a multi-sector healthcare ecosystem, from the government to insurers, pharmaceutical companies, pharmacies, all collectively coming together to say, how do we help to eradicate this virus and make this something that we can, more endemic, that we can deal with more like the flu? So now, whether someone thinks that we did a good job or a bad job globally, what we demonstrated is that we can come together. And so how do we think about this now from a societal impact of when you think about cardiovascular disease, which I would argue is a great crisis in our country today. One of the, was the number one disease in terms of us losing people. If you also think about cancer right behind it, how can we use some of those same lessons that we learned during the pandemic to come together to get after some of these really serious conditions that are impacting our society, and quite frankly, I would argue is a public health crisis.